Okay. Hello, everybody. It's Dr. Justin Tossing again. Beautiful Chicago night. Perfect weather. Even Lake Michigan, which is a monster of a lake, 921 feet deep, waves as high as 20 feet during severe storms, is as calm as glass. Not even a breeze. It could glide over that water real easily in just about any kind of watercraft, but that's not what we did today. We got prepared for this week's Bodyworkers Mastercourse. We're going to be focusing on the anterior thigh, anterior leg, anterior ankle, and medial ankle.
Yes.
And here's our star Bodyworkers Mastercourse teacher, Sharon Sauer.
Hi. So we're going to look at a few dysfunctions. Drop foot is one of the dysfunctions, and weak ankles. So, and repetitive sprains, things like that. So that's what we'll be looking at that today. So also on the medial ankle, we'll be looking at the tarsal tunnel. And sometimes you can have tarsal tunnel in the medial ankle there. So we'll take a look.
Like carpal tunnel, only down at the foot?
Yeah, right. Exactly. Yeah. It's in the foot.
Okay.
It can make your whole bottom of your foot feel really sore and painful. So really sore and painful, the whole bottom of your foot. So, so that's, sometimes hot, painful.
Good.
Okay. So drop foot and weak ankles. What do you think?
It happens.
So this is anterior leg, so this is pain in the front of the leg right here. Okay, and then pain in the front of the ankle, and then pain on the inside of the ankle right here.
Yep, and these are the pain keys we'll be looking at. You can see right here 33, that's right there over the anterior ankle. Then 30, which is right there over the anterior leg or shin. And 32 or 35, which is right there in the medial side of the ankle, the inner side of the ankle. Okay, and let's look at those muscles and see which ones cause pain there. So,
only two muscles cause the pain in the anterior leg.
Two muscles cause...
Well, two groups of muscles, so it's so it's three muscles. It's the tibialis anterior, and the longus and the brevis.
So there you have tibialis anterior.
Adductor longus and brevis.
Oh, so that's interesting. Adductor longus and brevis, that's way up there in the thigh.
Yes.
Like where 24 would be.
Mm-hmm.
And that causes pain right there.
In the anterior lower leg there.
Anterior lower leg.
And the tibialis anterior, peroneus tertius, and the extensor digitorum longus and extensor hallucis longus all cause anterior ankle pain. So pain right here in the front of the ankle. So four muscles cause it to hurt right here, but only two make it hurt right there.
Oh, interesting. Okay, let's look at those again. 30.
So that was 33.
Same tibialis anterior.
Tibialis anterior.
Which is that big muscle right here. It's on the outside of the shin there.
Then the peroneus tertius, which comes over here like this.
Yep.
So it starts here and comes over here, and that causes anterior ankle. Then you've got the extensor digitorum longus. So here's the extensor digitorum longus, and comes here down to all the digits.
Right.
And so it comes here.
That muscle that pulls the toes up and back.
That's right.
Goes all the way up there.
Yep. Starts all the way up here.
Wow.
Comes all the way down to each one of the toes, except for the great toe. And then the extensor hallucis longus,
which is great toe. Hallux means great toe.
Great toe, and that comes up all the way to here. So so here we've got, and this one here, all of them cause anterior ankle pain.
So the same muscles that lift the toes up and back also lift the ankle up and back.
Yep.
But the anterior tibialis is an extra one for the ankle only.
Yes, right? And this is your drop foot muscle right here.
So those are the three muscles that lift the foot up and back are the extensor digitorum.
All of them go to the digits.
Yep.
The hallucis, the one that goes to the hallucis.
Yep.
The tibialis anterior. And the peroneus tertius that comes like that.
The peroneus grabs it and pulls it up a little bit too.
Yeah, the peroneus. Okay, so here's our peroneus, which attaches over here. Excuse me, I don't know why I said that.
Yeah, so the peroneus...
So it attaches over here and makes your foot go like that.
So the peroneus pulls the foot up, but then out.
Out to the outside. Yeah.
And the others
bring it in.
In.
And out.
Exactly. The anterior tibialis, does it come under here,
comes
so
in
it
like
grabs
this
the
and
arch.
attaches there, like there.
Yeah, so it forms a sling on the arch along with the peronei muscles on the other side.
Yeah, so they both attach just about in the same place underneath the peroneus longus.
Exactly.
Yeah.
So they form like a nice little sling.
It holds up your arch.
Yeah, holds your arch up.
So
Okay,
now the
great.
peroneus longus can compress the peroneal nerve, which
Yeah.
then can cause you to have drop foot due to nerve compression. But you can also have drop foot due to this muscle having trigger points in it and not extending the foot.
Sure. So it happens to be that the anterior tibialis could have weakness and problems from trigger points, but it also could be having its nerve supply cut off by the peroneals.
Right.
So
there's a couple of things we're looking at there. Then we're going to look at medial ankle pain here.
medial ankle pain. That's
And
number
the
33.
adductor hallucis and the flexor.
I'm sorry, 35.
Yeah, 35. That's adductor hallucis and flexor digitorum longus.
Adductor
That's just
hallucis.
two muscles.
Two. Flexor digitorum longus. Now, where does that go?
So
'Cause
let's take a look at that.
the extensor digitorums go all the way up the shin, but how about the flexor digitorums? Does the longus go all the way up the back?
Yes, it does. Yes, it does. So it comes all the way up to here on the back of the tibia, comes all the way down and attaches on all of the digits, all the toes, except for the great toe.
Ooh, I'm having a little trouble visualizing. Oh, we're looking for the back.
Yeah, this is the back.
This is the back of the calf.
So here it comes here on the back of the tibia.
I see.
It comes all the way down,
Holy cow.
and it comes down and then down here to the digits.
And that's beneath the gastrocs and beneath the soleus?
That's right.
So it's way deep in there, huh?
Right. And it comes down here to the digits right there.
Wow. And then that's the brevis right
This is
there?
the hallucis.
Oh, that's the hallucis.
And this crosses it right there and goes down to the great toe
Oh,
here.
super cool.
Now let's take a look at the pain.
And those are both, those are the two?
This is the pain that it causes on the back, but also causes here on the outside of the ankle.
And I'm sorry, this is the flexor hallucis. How about the adductor hallucis? Where's that go?
Okay, let's take a look at that one. Here's the adductor. So here's the adductor, and it has two parts. This part here that goes across the toes, and this one here that goes up and down.
And that's the bottom of the foot?
Yeah, it's the bottom of the foot, yeah.
Okay.
So this is the oblique and the transverse. So this, actually the main job is to bring the great toe towards the lesser toes. That's its main job. So it brings the great toe towards the lesser toes. So so that's its main job. Let's look at the pain pattern.
Yeah, I was going to say, how does that cause pain?
This
in
is the whole bottom of the foot.
Okay. Sure.
And a little bit into the so that's the adductor hallucis. Okay, so let's take a look at the pain pattern for the tibialis anterior. Okay, so here's the tibialis anterior, causes anterior ankle pain, like we said, and great toe pain.
Ooh, I've had that exact pain. I've had pain right at
there.
my ankle, at the top of my ankle, and then my toes. Great toes
there,
hurting.
right there. So that's the anterior tibialis.
Ooh, my brother has it, but he thinks it's gout.
Then the adductor longus and brevis here, right here, so it attaches onto the pelvis and then onto the femur. It causes pain all across the anterior leg there. See?
Yeah, very nice.
We also treated that before for knee pain.
Sure.
And so that was okay. Then we're going to take a look here at the, this is again, we're going to think about the peroneus longus because it can compress the peroneal nerve, and also we'll be working with the peroneus tertius, which comes over here and attaches onto the outside of the metatarsal head there. Now this is where remember we have the two muscles. There's one that comes up and attaches, it goes across here. So this is the longus, comes across and attaches here. But also, so does the tibialis anterior attach here.
So they meet right there and form a
right
sling.
there and form a little sling. Right. So that's interesting, right?
Oh, yeah, and I thought that was interesting. You pointed out last time that the peroneus tertius goes in front of the ankle.
That's right, and that causes anterior ankle pain.
Whereas the other two
So here it
go
is.
behind it.
So here's the anterior ankle pain that it causes.
Peroneus tertius. Oh, yeah, I've had that too.
Yeah. So that's anterior ankle pain there. So those are, and then also we want to take a look at some of our other muscles here. So that's the extensor hallucis, causes pain here in the anterior ankle, And the extensor digitorum and the extensor hallucis both cause it here in the anterior ankle as well as down into the foot. So right here and here.
Wow, that's
The
both the muscles
hallucis.
here?
So here's the hallucis, and here's the extensor digitorum going down to all the digits.
Gotcha.
And it causes pain here at the anterior ankle and into the foot, which we're going to be doing in the next couple of weeks.
Oh, yeah.
So that's its pain pattern. And again, here is the longus, and that's its pain pattern right there. Now, sometimes that gets mistaken for tarsal tunnel syndrome because it causes pain right there at the tarsal tunnel.
Gotcha. The flexor digitorum longus.
Can sometimes.
And that curls the toes down.
That's right. That'll curl our toes down. That's what flexes our toes down. Okay, so we're going to do a little self-care and learn how to treat all those. What do you think?
Okay, yeah, that's great.
Get right to it.
Okay, so we know
We'll
what
give it a
they look
little
like.
try. Yeah, we'll work on that.
So this week we decided to divide the class again into, we're mixing it up, but this week we're going to show you first how you would teach a layperson or a patient to treat every muscle that causes pain in the front of the ankle, the side of the ankle, or the shin.
Right.
And then we'll go to what a practitioner would do to assess and treat as a body worker, as a professional body worker, those muscles, such as the range of motion testing, the strength testing. But this is something that you could do. You take the little protocols. Oh, do we have the protocol sheets to show them?
I was just going to show.
Okay, so
So this is for
30.
pain in the anterior, and it's only two muscles. It's the anterior tibialis, which we're going to do, and then the adductor longus and brevis.
Oh, that's so easy. That'd be a good one to practice. If you haven't done a protocol with the patient yet, that would be a super easy one to practice. Only two muscles.
But I did want to mention one thing that all the nerve roots that we're going to be doing is L2, 3, 4, 5, and S1 and 2, and that would be. You see that goes to all the muscles. This goes to the adductors, to the hallucis longus, tibialis, and the peroneus, and also the flexor digitorum and the adductor hallucis. So that would go here to the S1, S2.
That's right. It's just really, really useful to know that all of the muscles in the lower leg here, all of them are plugged in the lumbar and sacral nerves.
Yeah.
That's where all they're plugged in, just like all of the arm muscles and hand muscles are plugged in at the cervical spine.
So I thought we'd start with looking at the spine, and let's take a look at L2, 3, 4, 5, and S1 and 2, and we're going to use some little balls first and do it on the wall.
Yeah. Okay.
Okay.
So in other words, you would say when you got a patient who's got medial ankle, anterior leg, or something pain, you would say always help them. Always teach them to treat where the nerves are too.
Yes, you could treat we could look at the nerve roots and see if the muscles are affecting the nerve root function.
Well, you certainly would have agreement with the chiropractors.
Yes, we would. So let's take a look at you. Camille's, we've met Camille before.
Yeah, Camille.
Hi, guys.
Okay, so Stephanie, I was wondering if you could check over here, if you could do some skin rolling on her, and let's check to see if, let's put that underneath here, that'd be great. So let's go ahead.
Well, would you teach patients to do skin rolling?
I
Or
would.
You would teach them
Oh, yes,
to
I
assess
do.
their own
That would
skin
be
rolling?
great.
Cool.
Oh, yeah, that would be great. Well, one thing that they could learn. So
Okay.
I'll do it on one side, you do it on the other, okay? So here, so if we go here, this is like L4, so that's L5, S1, 2, so there'll be L4, L2, L3, so right about here. So let's come here, let's see if we can lift up any of the skin. And here it's hard to lift the skin up right here. Okay, so, okay, all right, so we have a little bit of dysfunction in there. So let's see if we can make it a little bit better. Okay, so can you evaluate Stephanie?
Sure.
And you could also do it, right through their clothes if you want to as well. But you can do it, just go ahead. We're going to go ahead, you do it on that side, I'll do it on the side. And here, oh, good. You're
very
rolling.
good.
Woo, it's
She
rolling.
rolls.
Rolling, this girl is rolling.
She's
Okay.
rolling.
So she's rolling really good. Okay.
Yes, very good.
All right, so it shows that those nerve roots aren't bothering her. Okay, so we've got some little balls. Let's take a look at you and let's see if we can improve your little nerve roots. So
Okay.
let's see if your rotatories, multipities, or your other paraspinals might be causing a little bit of nerve root. So
Okay.
here we're going to look right here, the same spots. We're going to use the ball and we're going to find the spinous process, and then we're going to go right into the laminar groove there between the transverse right there. And I'll do it with you, okay?
Okay.
Get right there. So one time,
Okay, it moved.
I-
That quick. Okay.
I was running a class for self-care, and I handed out these balls to 50 people, and 50 people dropped them at once. So these little balls, are a little hard to, so what you want to do is go up and down, side to side, and look for a little painful spot, okay? And then if you find a little painful, and press, is it a little too small, that ball?
No, it's okay.
Yeah, okay, so we're looking around. Let's go ahead and let's look around. Let's look for a painful spot. And let's go ahead and hold it, breathe, and relax. Okay, let's look on the other side. And let's go again, let's look around. So look around for a nice painful spot. Let's go over the sacrum. And over the lower, like L4, L5.
Where do we find these little balls? Where can we get them?
Sometimes I get them out of a gumball machine. Now these are here, I got them out of a gumball machine down in Nashville. And these I got at 5 and down.
5 and below.
Oh, below.
Yeah,
5 and below. Okay.
A dollar store might have some.
Yeah. So I go
Toy
up,
store.
So we go up and down,
Yeah.
side to side, and then we do little circles and looking for painful spots. So we're doing over the sacrum, then into the low back, up and down, side to side, little circles, looking for painful spots. And then we can go back and let's all feel our back there and see if we can lift up the skin there and see if it's really tight. But if someone else does it, it's a little easier. So if you had a family member or a therapist, if you could do the patient, it's easier to do if someone else does it for you. Okay, so let's check you and see if we improved you a little bit, okay? Okay, we can just go right through the clothes. That's fine.
You want to go through?
Sharon, if you are rolling the skin and it's painful,
Yeah.
the skin's very painful, what does that mean?
That means the skin's very tight.
Yeah.
Yeah, so, okay, so let's see. It seems it's still a little bit tight.
Okay.
So I think you want to stay with treating that
Right.
every day for a few days and see if we can loosen it up by the next time you come up with us. Okay, next, let's treat all the muscles that cause pain in the front of the leg.
Okay, great. Someone asked whether golf balls are also work. They're a little slippery, aren't they?
They're a little slippery. The reason I like these is because they're sticky. They're more sticky.
The rubber.
And they're not, they give a little bit, whereas golf balls, but if I didn't have one of these, I might use a golf ball.
Yeah.
And sometimes I wrap the golf ball in some sticky stuff that you use to put between plates.
Oh, yeah.
And then it stays where you want to put it a little bit.
Gotcha.
So there's sometimes I have used it. Okay, so we're going to take a look at treating the anterior tibialis. Okay, so let's go ahead and sit down. And you could use this little stool here. You could put your foot on this. You could put your foot on it. And I'm going to use this stool over here.
Oh, this is cute. Do you want that one or you want this one?
This one is good.
Okay.
Useless.
Okay. All right, so we're going to look at the anterior tibialis. And so it's right here in the front of the leg. So let's feel the head of the fibula over here. So everyone feel. So feel the little head of the fibula, the bone that goes on the outside here, and you feel the front edge. Now you're going to go right in the between there and get right there, and that's your anterior tibialis. Now this is a great tool to use, but you could also use this end of it and not press in quite as painfully. So what do you think of that spot?
It's an interesting spot.
Okay, so then you can find this edge of the bone, and then you're going to come outward and then press in, or lateral. So, and then we could use this when we're getting down into the tendons and stuff like that. Let's find the tibia. Then we're going to come a little bit lateral. Do you want to see it in the book, Justin?
Yeah.
Okay, so let's go ahead. I'll find it for you. I actually put the numbers of where they are in the right. If you open this here, oh, page numbers are right there. So here's the anterior tibialis. There it is.
There
And
it
then
is.
there's its preferred pain pattern. So it causes really bad great toe pain. How about if someone had a really bad great toe pain, but sometimes what do we call that when it's great toe pain, and it has filled with uric acid?
Yeah, gout.
Gout. Okay, so sometimes when people come in with gout, we just treat the anterior tibialis and their gout goes away.
Oh.
So frequently, at least by the time they've come to us, maybe they don't have the uric acid in there anymore, but just a lot of times one treatment, bang, the gout's gone. Yeah, and this also would treat the anterior ankle as well. So we're going to go down to where it attaches onto the bone, so we can all take our shoes off.
So that you'd feel a lot of pain right here at the top, and then right
Right.
here over the great toe.
Yes, but no, the great toe, if you look here, look how it really makes the great toe painful. I mean, see, it's really, like the great toe really hurts.
So what you're saying is somebody could have pain from gout, but that could get exacerbated by the muscle, and so even if they had gout, they might not have to have so much pain.
Well, every single person that's come in, their gout goes away in one treatment.
Well, the pain from the gout.
Well, whatever it is. I mean, but usually they're already taking uric acid.
Yeah, exactly.
So what's left possibly is just the
Exactly.
referred pain.
Exactly.
Yeah. So we get rid of what's bothering them, which is the
Yeah.
referred pain, and
Exactly.
they're already dealing possibly with the uric acid problem.
Yeah.
Okay, so we're going to come down like this, and then across is the ankle, and then we're going to come across and comes over here to the first metatarsal head, right there. So we can also we can press in more pointedly if we want to use this tool this way. So to go right where it attaches.
And that's pulling the arch up as it draws the whole foot back.
And then remember the other one we were talking about was the peroneus longus, and it comes down this way behind the ankle, over here to the fifth metatarsal here, and then over here and under and over here to the same spot.
Yeah.
You know, so the two of them together hold up the arch.
Yeah, cool.
As well as other structures. So that's your anterior tibialis, and let's go ahead and we're going to stretch it.
Okay.
And we're going to so now a good test for that is, can you point and pronate? So let me try to do that with you guys. I'll do it to you. So I'll do the little stretch for it. So go ahead and put your foot right here. So you point it and you pronate. That's the stretch. Okay. Can I have yours, Stephanie? So you point it and then you pronate, or you turn it inward.
Yeah.
Okay.
Turn it into a tool.
Yeah. Now, how could we do that? Well, we could do that on the floor like this. And then we could go like that. So we could go different directions on here, and we could stretch the front of it. Yeah, it's a good stretch for it. Okay, the next one we're going to treat is the adductor right here. Okay, so there's different
and
ways.
you would treat for the nerve. You would treat the peroneus.
Oh, then we would treat the
Peroneus
peroneus.
longus.
So we could just go ahead and do that now.
Yeah.
Okay, well, let's treat the peronei. Okay, so for the peronei, we're going to go right here on the outside of the leg, and now we're going to find again the little head of the fibula. Then we're going to press right onto it. So we're going to find the head that comes just a little bit lower, gets pressed right onto it, and we're going to go down the outside of the leg here, and we want to get the whole muscle to relax.
Cool.
And sometimes I like to treat it and move it a little bit while I'm treating it, which just often works really well. Then we're going to come here behind the peroneus, behind the malleolus, all the way back here. And remember, down to this metatarsal, this part that sort of sticks out right there. So across here like that. And then we'll give it a little massage. Let's go ahead and give it a nice little massage. Okay, now this muscle, the stretch for that would be to turn the foot in like this, and then the contraction, the range of motion, stretch it, contract it, stretch it, contract it, stretch it. And for the anterior tibialis, and then contract it, stretch it, contract it, stretch it. Okay, so that would be get the nerve, so we get rid of the drop foot, and then also to help us with the muscle that could cause a drop foot.
Great.
Okay, so how about the adductors? So the adductors are right here. They attach onto the pelvis right here, and then right onto the femur right here. So a couple different ways we could treat that. I thought you could use a tool like this to treat it. The jackknobber might be a really good tool. You got your jackknobbers? And I have an old tool from a long time ago.
Oh, yes, I've got one of those.
They don't make these anymore.
I don't think so.
Oh, but so one of the tools we're going to use is the jackknobber, and then we have another tool here, this knobble. Okay, so let's take a look at the adductor muscle here. We could take a nice picture of it there. Remember, it causes the pain in the anterior leg right there. But here's the muscle. It attaches onto the femur and then onto the pelvis right there. So let's go ahead and go right where the pelvis, right onto the pelvis. So feel the pubis, and come a little bit lateral right there. So this would be the adductor muscle. And let's come down towards the femur. And let's come towards the femur. And come down a little bit. And then towards the femur. Now we're looking for a painful spot. So if you don't have a painful spot, just move on to the next spot. Just look around for a painful spot. So you're looking for a painful spot that's filled with sensitizing chemicals. And so we're looking around for that right here. And looking with, oh, I found a little spot here.
I found one.
She found one. Okay. Okay, and so we're looking for some of those painful chemicals, and we're going to hold it, breathe, and relax. So this is a good tool. But another good tool would be the back knobber. You know, so that'd be a nice tool as well. Do you think you could get us that one? Yeah. Okay, so that's this muscle here, and it adducts, so you use it to cross your leg. So that would be crossing your leg and uncrossing your leg, and crossing your leg and uncrossing. You can see what the muscle is doing when you're doing that. Crossing and uncrossing. So that we can take a look. Oh, that could be my favorite one.
Her favorite one. Yeah.
Okay, here's my favorite one. Okay, so here you can feel the pelvis right here.
Let's go to the other leg.
Yeah, I'll do the other leg. So you feel the pelvis as the muscle attaches onto it right there. And let's come down a little bit inferior, looking for the attachment onto the femur. And a little bit more inferior, looking for the attachment onto the femur. And now let's go a little bit more medial and up. And we're just looking all through here at the adductor longus and brevis. And then a lot of times I like to look and see how the muscle works. So let me see, does it go this way? So I like to feel it. And I feel the muscle. So let's see how it's doing over there. So do you feel it adducting? How's your adductor doing?
Mm-hmm.
Okay.
It's moving.
Okay, it's moving. Okay, good. Okay, good. Okay. All right, so that's our adductor. And a good range of motion exercise for that. You want to do it with me? I'm going to take both shoes off so I'm slightly more even. Okay, so again, we're going to go like this. This is a good stretch for your adductors. Stretch like this. Stretch and stretch and stretch. And hold it there. Breathe and relax. And breathe and relax. And breathe and relax. Good. So then the other one we were doing was the tibialis anterior. Contract it, stretch it, contract it. And also we were just doing the proneus, 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 all the proneus together. Okay, so that's the anterior leg pain. What do you think?
That's it?
So that was it.
Wow, super easy.
We got through that pretty fast.
So people
Okay.
who sprained their ankle and who have drop foot or just pain in the front of the ankle and shin, that's front of the leg pain, right?
Yeah, front of the leg.
Great.
Yeah.
There's a
Okay, so
couple
the
more
next
for
one
you.
we're going to look at is tibial, the front of the ankle. So for this, we're going to add a couple more muscles. So we're going to make sure to do the proneus tertius, the extensor digitorum longus, and the extensor hallucis longus. Okay, and here's, if you download the protocols, you'll see here it's showing you the different muscles and where you could put the little X's on it. And then here I show you how to use the little tools and press in to the different muscles with the tools. So there's nice pictures and different ways of doing it. So this is one way you can do it with a foam roller. And here's you doing it as we are with the jack knobber. And sometimes you can just use your fingers. So we did all different ways here, just with your fingers. So so then this gives you a lot of instruction, doesn't it, Justin?
Yeah, oh, tons. Someone brought up
Okay.
a good point. They said that those muscles would be affected by the first metatarsal deficit because, of course, they go right there.
So one thing that we could do, what's a nice solution for that?
Yeah.
So one thing is we could call these pelvis stabilizers and shoulder stabilizers and knee stabilizers. So it's the knee stabilizer, shoulder stabilizer, pelvis stabilizer. Okay, so one thing we could do is we could correct it with just a set of these. So here you've got a set of soulmates here, okay, and you could use those to correct the hyperpronation, and you could go ahead and put that right on just like that.
Yep, they're called soulmate microlifts. And can you show how you would put 2 on? Someone was asking how would you put 2 back to back?
Oh, someone was wondering about that, huh?
Yeah.
Okay, so you'd put this just like this. So this would be right onto your sock right there. And then you could walk around the house with that, right?
Yep.
That'd be nice.
Yep.
Okay, so another way to do it is you can, so let me put the one on the other foot, and then we'll do that. So what are you guys doing over there? You could.
I'm working on my tibia.
All right, go
on
ahead.
my peroneals.
Okay, she's going to work on her peroneals using her back knobber there. Okay, so here's you put it right where the right where the bunion grows, right there.
Yeah.
That's where you want to put it, right there. So we're going to put it right there, and you can put it right under the big toe.
Will that prevent or reverse the bunion? Maybe?
Yes, it does. It's incredible.
Wow.
Because you stop because the bone grows where you put where the stress is.
Yeah.
So if you get rid of the stress, you
Bone
may
goes back to its shape. Wow.
right. Oh, now you may need more encouragement. It might be useful to actually treat all the muscles and everything like that. But it still is really big encouragement just to put the first metatarsal lift in there.
Wow.
Yeah. Yeah. Okay, so here we go. So someone asked the question, how could you square it off?
Yeah.
Okay. How did they know to ask that question?
They want to know if you could put 2 to make it a higher lift.
Oh, to make it a higher lift.
Right.
I usually don't do that, but you could do it. You could try
what you're
it.
doing right now is a good way.
So this is one thing I do sometimes is I do it this way. So I'll show you what I usually do.
That adds more lift.
Okay, so what I do is I put the on opposite this way. So I put it on this way. So I get the 2 of them, but then it makes more like a square instead of like a. At any rate, that would be one way of doing it.
Oh, that looks nice.
Okay, so now I'm corrected, you guys.
Yes.
Totally corrected here. And then
Yay.
sometimes, maybe if I was treating people, I might wear my corrections while I'm on my
On your
mat
hot
here.
coals.
On my hot coals. Right, on the hot coals. Okay, so let's go ahead and take a look at some of our muscles again. So the 2 muscles we were going to treat that we didn't already treat were the extensor digitorum longus and the hallucis longus. Okay, so let's take a look at them. Right here. I was going to show a little
So there are a
picture
couple
of them.
extra when it comes to the ankle.
Yeah. Oh, well, yes. So let's so let's go ahead and look at it here. So this is
33.
anterior 33.
Peroneus tertius extensor digitorum longus. Whereas 30 was just tibialis anterior and the adductor. So the adductor has a bit of referred pain down in the front of the leg, but the main one is the tibialis anterior. And here, the pretty much all 4 of those are pretty strong competitors for causing ankle pain.
Right. So here's the extensor digitorum longus, and it's coming down in here to all the toes.
Yeah.
And here's the hallucis right there. Okay, and so the extensor hallucis longus, and we call Travell like to call these the hammer toe muscles, the hammer toe muscles.
Hammer toes, exactly.
And of course, the first metatarsal helps with hammer toes a lot.
So explain what hammer toes are then?
Well, a hammer toe. Let's take a look at what a hammer toe would be. So the hammer toe would be. You would have the toes would come up like that. That would be like a hammer toe.
Yeah.
And then the bones would come up like this, and that would be the extensor digitorum longus would be attaching right there, and it would be pulling up those. But one reason you have that problem hammer toes is because the interossei muscles, these little interossei muscles between the toes, aren't moderating the long toe muscles. So the extensor digitorum longus and the flexor digitorum longus, those muscles could be dysfunctional, and partly, and you want to make sure that these interossei are moderating their pull, so that you get really delicate pull and delicate extension.
So what you're saying is that the extensor digitorum doesn't go to the last part of the toe; it goes to these knuckles,
right?
And so it yanks them up, and the last part curls down because the others are yanked up.
That's right.
That's
just
why
like that.
Form a hammer.
Yeah, like a little hammer like that, and then usually this toe comes up. Now, one person in one of our classes, their toes got almost like seemed like an inch longer once we got the hammer toes out of there. Okay, so let's take a look. We're going to go.
Extensor digitorum longus. So that's behind the anterior tibialis.
Yeah, so it's a little bit. So here's the anterior tibialis, and so you feel the fibula, and go just a little bit in front of it, and a little bit lower, and that's our digitorum longus.
And that's going to come all the way down front of the foot and grab onto all these toes.
Yeah. Let me see. Make sure. Can I take a look at you guys?
Sure.
Okay. So can you give me your little foot?
It is little.
Okay, so we're going to take a look here. So we're going to take a look at this. So here's our tibialis anterior. Here's our fibula, and here's our extensor digitorum longus. Okay, so we're just going to come here like this and look for painful spots.
That's one.
Oh, okay, so once we find a painful spot, you're going to hold it.
Right.
Breathe and relax, and you can use different tools. You're going to keep coming down.
They're all tender. That one's not too bad.
Okay, and you're going to look all the way down and come down to all the digits. So you're going to come down like this. So over here, you're going to come and go all the way down to each one of the toes. Okay?
Yeah.
So go ahead. How are you doing over there, Stephanie?
So when you teach self-care, you'll do it on the patient so they can see what it feels like?
Yes, frequently. Yeah.
Cool.
Okay, so how's that feel, Stephanie?
There's a lot of pain.
Oh, she found some painful spots? Okay. Okay, and then we're going to take a look at the hallucis longus. So so how's that feeling?
It's tender.
Okay.
I don't have hammer toes though.
No, none of us have hammer toes. Yeah. Now I used to have a super big bunion right here, and now I couldn't. All this toes were all squeezed together over here, and now it's totally straightened out, and I can spread my toes and everything, which is important.
Oh yeah.
We want to get our toes all spread out.
So for the extensor digitorum, here's the referred pain. You can see it goes right over the ankle.
The anterior
there.
ankle, and to the lesser toes.
And then the extensor digitorum, or extensor hallucis.
Yeah, the great toe goes to the front of the ankle and then towards the great toe.
Perfect.
Okay, so next let's take a look at the hallucis. So we're going to come over here, take a look at your hallucis.
Oh, also, Sharon, would you say that it's oftentimes very important to treat on the attachments themselves, like really, they may be very tender, may not feel like a lot of flesh there, but really to get on the insertions onto the toes?
Well, I really like to go, so I really like to go to, so I like to do this, I like to come right like this and go on each toe, and then stretch the toe, and get right onto the toe, just like that.
Thank you.
And come all the way down, right towards attaching, right on the hammer.
Exactly.
All the way down.
Yes,
so we can do that. That's good. So if we could, so it could come and look around for painful spots. And sometimes what I would do is make it really put your feet in hot water first, and so it's not so painful. And also when you're moving the toes around, you probably ought to massage them with some cream first, because sometimes if you haven't been using them very much, they could get all hard and you could crack the skin. So you want to make sure all the skin has a nice cream on it, so it's nice and soft when you're moving all this stuff, because you don't want to break any of the skin. Then you're going to come here and keep coming down, and you're going to go ahead and each toe that you're stretching, you're going to go ahead and
you might as well go in between the toes and get the interossei there too.
Well, you might as well.
It'd be hard to avoid them anyway. It'd be hard to miss them anyway.
Okay, so I'll just do it this way so you can see better. Okay, so here, so I come right along each one of the digits. Come right along and go all the way right onto the toe. Now the baby toe.
See how she's got Morton's foot? See how the big toe base of the big toe is behind the base of the second toe.
I think we all have
And there's
that.
a deeper
You have it
webbing
too?
in here
Yeah.
than
Right,
here.
deeper here.
Yeah,
So
we've
this
all
is
got
deeper. This
that.
is more superficial here. Yeah. Mhm.
See, we
So,
all got
yeah.
that.
So
So
theoretically,
that's a
this big toe is supposed to develop just a little bit further, so
That's
it's
right.
slightly longer.
And this one's
Yeah,
longer.
yeah. But you know, the thing we're mostly concerned is this first metatarsal
Yes.
not touching the floor.
Yeah, it shouldn't have to roll in order
And you
to touch
shouldn't have
the
to
floor.
do like that to get it to touch the floor.
Exactly.
Yeah, you want to be able to touch and make like a tripod.
Yes.
So here presses and here presses and the heel.
Yep.
So these two in the heel.
Remarkably important and totally overlooked.
So we were doing the interossei, so we go in between the toes, like here.
I
Can you
spread them,
see?
maybe?
Mhm. That would be good. Oh, I did bring a toes. Oh, I might have left the toe spreader at
Well,
home.
they know what they are. The toe spreaders,
Mhm.
you know, great way to treat the foot muscles is with the toes in a toe
So you
spreader.
can also spread the toes yourself. Go ahead and spread them,
Sure.
and then go in between the toes like that, and look for some painful spots. And sometimes when I'm treating on these people, this is so painful.
Oh, it's screaming. Yeah.
I mean, this is so painful they can't even believe how painful it is.
I know.
It's so painful. Yeah.
Yeah.
At first, but after a while, it's not painful anymore.
Yeah.
I do frequently do this on myself, so it's not very painful and it's not bothering me very, and here and there I got a painful spot, but not too many.
Well, warming it up helps. There's
Yes.
another little trick that I learned. If you grab the top and the bottom, just so that
So
you
press from the top and the bottom at the
press from
same
the top and
time.
the bottom, yeah,
Mhm.
and just hold it and do like a wiggling sort of thing. It starts to loosen up the tissues there before you start pressing real deep, and it'll almost get like a little hot and warm, and then the pain goes away. You can get into it really well. So you go one by one and loosen them up.
That'd be really good to do on
Yeah.
your partner, your treatment partner.
Yeah, exactly. It feels great because if you go straight in, sometimes they won't love you for that. And right away. Later they will, because literally it'll be so excruciating. They think you're hurting them, and then it will go away.
Okay, let's treat we didn't go do the hallucis, so we're going to go up here about a third way up the tibia.
So the big
And
toe
this
is
goes-
so
and this
important. It
goes
gets its
all-
own branch.
It gets its own muscle.
Wow, its own muscle.
See there, it goes from here and goes this way and then goes to the great toe, right there. Okay,
That's how I like to
And
think
then-
of myself.
and the-
I'm like the great toe.
and then there's little slips that go further down as well, but in affecting the tip of the toe there.
Great.
Okay, so let's take a look at that hallucis. So we're going to go right here, and we could feel it. Maybe we could go ahead and we could resist, and we could feel where it is.
Oh yeah.
Up on there,
exactly.
up there. You
Cool.
can feel it. Mm-hmm.
That's a cool way to see it.
Mm-hmm. Then we could go ahead and press on it. Look for a painful spot. And we're going to come across the ankle, and then right down the great toe. Straight down into the great toe.
Yeah, it's really neat. You can feel the difference when you extend your entire foot. You feel the tibialis anterior contracting, but if you just extend the big toe, you feel the little extensor hallucis contracting in there. And they're two
Right.
different muscles, but
So push, and you can feel it right there.
yeah, right
You
there.
feel it right where it is. Push, and you feel it right here.
Yeah.
Okay, and for the extensor digit, the little digits, the same thing. You could push against, they have them push up against, and you can feel them here.
Way up there.
Mhm. Okay, so now, what's a good stretch for those? The same thing we did with the anterior tibialis, only a little bit more on the great toe, and a little bit more on the lesser toes. So a little bit more on the big toe, and a little bit more on the little toes. So that all stretches, and then of course contract, and then stretch, and then contract, and then stretch, contract. So that helps us with everything that causes front of the ankle pain.
Totally
So we did that.
incredible. Don't you think most people could do that? I mean, it makes perfect sense. People should be able to take care of themselves. And here's a perfect example how easy it is.
And I usually treat my feet almost in my lower leg almost every day a little bit.
My wife and I do every day.
Yeah, and I love to treat anything that feels tender or painful, and I
Yeah.
go ahead and treat all of them.
Oh yeah.
So next we're going to take a look at the adductor hallucis.
Okay.
So the adductor hallucis goes across here and then comes down this way, right? So what you want to do is pull it outward this way, and that's stretching it. Okay, so we're going to go ahead and press in on it here, and then also down through here, and we're going to stretch it. And
Let's see where that looks again.
oh yeah, let me get it out for us, okay? Okay, so here's our helicis here. So it's right here. So it goes across the toes there. So here it is. It goes across the toes and then attaches down here to the cuneiform and the other metacarpals, tarsals, the other metatarsals right here. So okay, and then attaches here. So it's bringing the toe towards the little lesser toes. So bringing the great toe toward the lesser toes.
Is that the one that has the little sesamoid bones in it?
It does, yeah. It does.
Yeah.
Wow. Okay, so let's take a look at treating it.
And its pain pattern is pretty easy, right?
Oh, it's on the bottom, right there, right there. I put little right here. I just put little so you can see it.
Yeah, exactly.
So it goes, hurts all over the metatarsal heads.
Yeah.
Yeah, it hurts all over the little metatarsal head. So let's go ahead and treat that one.
Oh, it feels
So,
great to treat
okay,
these.
so we're gonna stretch them a little bit. So let's go ahead. We'll stretch that helicis there, and we're gonna go here and press in, and see if we can feel those little muscles right there. Like you can feel them right here, so you could go right
going from here and grabbing onto the sides of each of the base of the toes there.
Right in there, yeah. Right here. Right here.
Oh, that looks good.
And sometimes I take my fingers and put them between if I don't have a toe stretcher. Put my little fingers between them. And that stretches that. Now we got them all stretched. Got my fingers in there. And let's go down to the metacarpals. Tarsals.
Yes, these are the tarsals.
Tarsals, I meant to say. Okay, squeeze them together. Squeeze your toes together so you can feel the muscle, and spread them apart. And squeeze them together. Squeeze, squeeze, and spread them apart. And squeeze them together. And spread them apart. And to get rid of a bunion, what I do is I have you really work on that adductor helicis and also on the abductor as well here. I work on the abductor and also the flexor. Make sure the flexor is working and make sure the interossei aren't also pulling the great toe inward. So I like to look here and see how all these muscles contribute to the great toe coming in. So I'd like to feel it. I can really feel that fiber right there, and then I like to make sure that I get it really moving good.
What's that you're working on right now?
This is the transverse head of the helicis.
It's still more of that. Oh yeah, it's all that right there. Go right down there.
And then you could also, while you're at it, get the flexor in there. So I like to make sure all these toes work good. It's so important. I just feel like I need to do this. It's one of the most important things.
Yeah.
Okay, so then also we're going to take a look at the flexor digitorum, okay? Let's take a look at that. That's one right here. So it's the back of the leg here. And it causes pain on the medial ankle, okay? And that's what we're taking a look at now, is the medial ankle. And here it is, attaches here on the posterior tibia. And down, 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 down. And then down through here and down to each toe. So that one sometimes, and we're going to take a look at the tarsal tunnel. Won't that be fun? What do you think? Tarsal tunnel?
I don't know. Maybe it's fun. We'll find out soon.
Okay.
Tarsal tunnel
Did we
fun?
go to?
This is medial ankle pain.
Oh, yeah. So now we're going on to medial ankle pain, right?
Yes, medial ankle
So
pain.
this is 35, and it's the abductor, which means pull away. Abductor, away. Not add, like bring them together, add them together. And that is
Ab away.
ab away.
Ab away.
this is the flexor.
Yeah. And then there's the flexor digitorum. So those two muscles,
It was
only two, right? Abductor hallucis and
it
the
was
flexor digitorum.
adductors. We did the adductor hallucis.
Oh, sorry.
Adductor.
What's wrong with me?
No, I don't think so. Well, maybe. You tell me, but I'd say this is the muscle we retreated with the adductor hallucis.
Uh-huh.
Okay, adductor hallucis.
Oh, yeah, that's for that one. Right. So for the medial now, it's abductor. Well, it says on that sheet. I'm sorry. No, it's not. Okay.
Okay, so okay, the abductor. Let's do that one. Let's do the abductor hallucis. So that the abductor hallucis is right here, attaches right here, and you press right onto it right there, so it attaches here, and then all the way over here to the toe. So let's go ahead, and we're gonna press on it and move.
Okay.
And let's go ahead and that would be causing some medial ankle pain. And we'll come all the way this way. Do you want me to find that for us?
Sure.
Okay.
Did you have it sticky?
So the adductor hallucis. Okay, it's right here, so you can see where it attaches. So also here's it in red. So here we're right on it, and we're going right over here. So here onto the heel, then all the way over here to the.
Wow, so that's really interesting. I haven't looked at these in so long. So the belly of this muscle is way back here.
Way up here, yeah, right by the heel.
So when you go
Right there.
here,
Mhm.
that's the belly of the adductor.
This is the main part of the adductor hallucis. So you can go ahead, you can feel it here. And then you can feel it here.
Abductor, sorry.
Yeah, abductor.
Abductor, because this pulls the toe away.
That's right.
From the other toes.
That's right.
Abductor.
The abductor.
And the adductor was this big two-part thing that went all throughout here.
And all the way to the toe.
Wow, that's great.
And then so that's I treat this one almost every day.
Yeah.
I like to treat that one. And the flexor, okay. So that's good. Now, how about the tarsal tunnel? So we take a look at that.
Well, yeah.
Okay, so that's right here. So remember that the flexor. We can think about the flexor hallucis longus first. So it's going to come. Let's find the tibia, and let's come over here. We're going to press in, and we could flex all the toes and then extend them. Let's come down a little lower, and then we're going to flex them and extend them. Let's come down a little lower. We're going to flex them, extend them. Let's come down a little lower, flex them, extend them. A little bit lower. How are you guys doing over here?
Doing good. Finding spots.
And then we're going to come down, and then we're going to come all the way to each digit. So we're going to come like this. We'll come down here to each digit. So we're going to stretch it. Remember, like we did when we did it before on the extensor side.
So I'm sorry, you say to treat the
Flexor digitorum longus. Okay, so it started here.
That's what causes tarsal tunnel, or that's what?
But it doesn't cause tarsal tunnel.
So,
no, well, Travell points this out that sometimes because it causes pain over the tarsal tunnel, that it's sometimes mistaken for tarsal tunnel.
Gotcha.
So we're treating what sometimes seems to be tarsal tunnel syndrome.
Like pseudo-tarsal.
Pseudo-tarsal tunnel syndrome. That's right. That's right.
See the referred page for that too?
That's right. That's right here. Let's see. I guess it's. I put the. Okay. We're gonna. Here it is, right there. And this one is. This is the. So it goes here and it causes pain right here, over the tarsal tunnel.
Gotcha. And then
Now,
a big ball of pain at the bottom of the foot there. All right.
Okay, so I'd like to show everyone the tarsal tunnel here. So I'm going to show. So here, you're gonna find the malleolus, the ankle bone. We're gonna treat all the ligaments that are below the ankle bone and attaching to the calcaneus over here. So we're gonna take a look through here, and so what we want to do is find the ankle. Then we're gonna go like this, shorten it and lengthen it, and shorten it and lengthen it. And if you release this, what happens a lot of times is you get rid of the compression on the plantar nerve, and you can also get rid of the compression on the lymphatic drainage out of the foot. And then we'll give it a nice stretch. And we're trying to get the ankle to go this way and that way. So you're trying to get the heel to invert and evert. Invert and evert. And you want to get, if you can get this right here, I can see it's a little too tight right here. Okay.
That's okay. The other one was tender.
Oh, some other spots were more
No,
tender?
that one was
Oh, that one? Okay.
Yeah.
So we're trying to get it to evert more, okay? Like that. And so sometimes if you're walking and if you think, oh, my feet feel really sore and burning, if you just stop for a minute and go in here and treat the tarsal tunnel, you may find that your sore feet go away. Yeah. Now I find a nice tool to use that can take. Sometimes I take with me when I go places is this little tiger tail. So sometimes if I'm treating the adductor hallucis, I might go ahead and treat it. Remember, it was right there on the heel.
The abductor.
The abductor hallucis right there on the heel.
Yeah.
And then you're going to go right there and press onto it right there and go all the way to the toe.
Gotcha.
How about the flexor hallucis or the adductor hallucis? We can go do the attachments of all the flexors here.
Yeah.
Which is good. And also right here on the ball of the foot, you can get the abductor hallucis right here. So this is a nice tool. Also, I like to use it for treating the anterior tibialis right here. And down here to the metatarsal head, like that. Also, I like to take a look at treating the peroneals like this. So this is really great. So it's a nice tool to use to treat yourself.
Great. So we did it. We did everybody see, we did the tibialis anterior, and we did the adductor longus and brevis. Okay. Oh, the adductor longus brevis is the only one that's out of the area. that's up in the thigh, but it refers pain down to that area. Everything else is down in that area. Tibialis anterior, then peroneus tertius, extensor digitorum longus, and extensor hallucis longus, and then abductor hallucis, and then flexor digitorum longus. So that's not bad. A lot of really cool muscles in a very cool area of the body, and all those little, 25% of the bones of the body are in the feet, because every joint tells the body where it is and where the body is in space. So you need good balance and coordination in your feet, so you don't want trigger points in these muscles. If you have trigger points in these muscles and they're not moving as well, then that's less information from all those joints going up into your central nervous system, which affects coordination and balance. But also, as we've talked about, what keeps the brain healthy is input, like that old Short Circuit movie with the robot. Input, need more input. The brain grows and stays healthy when it gets input, and it gets input, a whole bunch of it. I can't remember how much, but there's some ridiculous amount of something like 60% of all that the brain is doing, all the activity of the brain is input from all the joints and muscles and other mechanoreceptors in the body. So if you don't get those joints moving, you're cutting down a lot of healthy brain nourishing input into that central nervous system. Every time you move it, that's giving a kiss of life to your nervous system, keeping the brain and all those nerves healthy, alive, youthful, growing, regenerating. So movement, it's the kiss of life, and these little joints of the foot are a huge portion of that feedback. 25% of the bones in the body. That's so that you can get mega amounts of input from your feet into the brain so that you're good at balance and you can do sophisticated things like run or skip or all the different things on any kind of surface. So don't always walk on a flat surface, right, Sharon? You would want to work on different kinds of surfaces.
Well, it'd be nice to, so that's why I'd like to have this to work on, because I can work on different kinds of surfaces.
Exactly. Sand and grass and all sorts of cool surfaces.
So walk on every different kinds of surface. Yeah. That'd be best.
Yeah. Your brain will be light. Just think of your brain as a lamp, just lighting up when you're walking on those surfaces. We're getting all those little muscles of the foot to move.
Super. Well,
okay, it's time for a break.
So if we could take a little break, and then if you could all pair up, and we're going to train everyone to treat each other, or therapists to treat a patient.
Yeah. So now we'll switch into more of a therapist does it. What does the therapist do to the patient? The assessment, the diet, the treatment plan, all that kind of stuff. So, great. Okay, we'll be back at 7:40. Oh, and I won't put any music on in the interim because last time we accidentally had some Led Zeppelin playing and they muted our video on YouTube. That was just so funny.
So you're not going to put any music? No music then, huh?
Well, I might find some. Yeah, I can put on some.
They didn't seem to mind our Hawaiian music.
Yeah. I got an idea. Yeah, but that was it did sound ecstatic. I agree.
I could tell it was a waterfall.
Sounds so much like static.
Yeah, the whole plantar fascia.
That's why I'm working this foot now.
Yeah, the entire.
Because that's what I have on this foot.
Not just, it's like it feels the deep, burny. If this your feet hurt, this feet hurt, achy, swollen feet.
I have the plantar fascia. It doesn't burn, but
I don't understand why this camera is so much better.
No, I thought the periscope was
It's always losing focus. You have to keep refocusing. This is so much clearer.
Well, how can that be?
it's a better phone, maybe.
This one, what was that?
Maybe the megapixels might be different. Like the periscope is a newer phone, right?
The periscope phone is a newer phone.
Sometimes they tweak little things on each version. So
Yeah, it is different. It is different. Yeah, I thought it was better, but he's noticing that it's not.
Nobody came up to me at the convention and said they watched it.
Yeah, they didn't.
But there were a lot of newer people there. I saw a few of the people I've known from before.
Yeah.
So, in order for them to reset your account, this phone has been deactivated from that system. So don't try and log in on anything until they give us the okay that they've set it up. Then we can log in. You probably do it anyway.
No. don't log anything related to Periscope. You meant?
I wouldn't even log anything.
Yeah, I don't log in very much, but I don't log anything for a certain length of
It
time.
might be 10 minutes from now, it might be tomorrow.
Oh, yeah, just a certain length of time. Okay, right, wait to do anything. It's torture, she says. Yeah, that's well, that's, yeah, that's how they do it when you have fire.
Walk on the coals.
On the
think of it
coals.
as clouds.
Cold, you think cold.
I'm not walking on hot coals. That's what I call this. This is but I've never done that. And I've never no hot coals for this girl.
Are you gonna try hot coals sometime? Okay, see, you're ready.
Did they do that in Hawaii?
Yeah, we could do it in Hawaii.
I heard something back here while we were working on it. I was like, because it's not the bunny one. It's not right here.
Somebody. I was too embarrassed to tell them I didn't recognize their voice.
Yes. What they say?
They recognized me. They were coming to the class today. There was somebody, I don't know who's come before. It was, I had her saved in my phone as newsletter prospect. She's someone who was in Chicago area who wanted to sign up for a newsletter.
So somebody was,
Anyway, she wanted to come tonight to the class. She said, what time should I come there? How do I get there? No instructions.
Did you tell them? But they didn't come? Okay. Oh, okay.
No. I can check my phone.
You got something? Okay, so I'd like to, do you think it's okay if we treat you? Do you think it'd be alright?
Definitely.
Okay.
I miss you to see you in the
Okay, you're slow. Okay. 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 Alright, so it's
Stephanie has these two. And I've got this one.
Okay, you want all three?
You can work on her on these two, 30 and 35, and me on 33. Or whatever we're gonna do, yeah. She was screaming a little bit. Screaming silently. Yeah, she's got the top of the we're good moms because we got stuff.
And we're back. Setting up with some hot water packs.
You want to put little
Foam
hot
Tech
water
bags.
bottles? Yeah, we're going to put little hot water bottles under here. So this the Foam Tech hot water bottles.
Sharon calls those bottles.
Oh, you don't
They're
call them that?
bags.
They're
You would call
bags.
them
They're not
bags?
bottles.
They're bags.
Bottles.
Someone take bags.
Them as bags.
They can be bottles.
Okay. All right, so we're going to do a few range of motion tests.
Free range of motion tests.
So just, yeah,
So if you had a patient coming in who had ankle pain, front of the ankle pain, or front of the shin pain, or even medial ankle pain, these are the tests you would perform.
right. So we're going to do test number 39, 40, 1, 43, and 44. So let's go ahead. We're going to do test with the adductors. Let's go ahead and lay on your back.
Yeah, range of motion is part of our three-part assessment, right?
Yeah.
Referred pain, range of motion, and palpation.
Yeah, so we're going to do the figure 4 test. So we're going to come up to here like this, and then we're going to go ahead like this and see how close, if you could scoot a little bit to that side of the table.
What muscle is that for?
Adductor longus and brevis.
That's for the adductors.
Yeah. So we're going to see, so what if it were here?
Oh, yeah.
So then we measure from the lateral kneecap to the table. That'd be 13 inches. That'd be pretty bad adductors.
And that might cause some referred pain down into the...
That's right. So we're looking for the pain that causes referral over the tibia here.
Right.
So right through here, right over the bone. Like you said, it's got pain right on the bone.
Wow.
Right,
And
right on the bone.
A lot of pain would be up here, but also...
Oh, yeah.
But that's part of the referred pain's on there, too.
So I like to measure it this way because then I have a little more space to measure. So here I measure from the lateral kneecap to the table. And then here it's 6 inches that way.
Great.
And then this way is about lateral kneecap is 4 inches. So
Great.
okay, let's try it on the other side. So scoot over onto this side. Okay, so we're gonna go ahead and come like this. Then you're gonna scoot a little bit more to the side. Again, we're gonna measure from the lateral kneecap to the table. That's 3 inches. And then, okay, we're going to put your pelvis there. So it's a little tight on this side.
Oh, yeah.
Yeah. This is 9 inches here. Yeah. So that's a little tighter on this side. Yeah. So I'd say so it's like pretty low on the other side, but so this is the one we should treat. Okay? See if we can improve that one. Okay? Okay, so then we're going to take a look at the anterior tibialis test. So let's look at that over here. So that's anterior tibialis test. We named it 41. And it's anterior tibialis test, and you're gonna pronate the foot, and also we're going to flex it. So we're gonna flex it and pronate.
Okie dokie.
So let's do it. We'll do it on this one first. So we're gonna We're going to flex it, and you can feel there's a little bit of, then we're going to pronate like that.
Yeah.
So that's pretty good on your, this is the anterior tibialis.
The anterior tibialis doesn't affect the toes.
Yeah, so then now we're also going to do it with
Now
the
we do-
toes.
Yes.
So here we're going to do the toes, and then also we're going to do the great toe. So all of those are tight. So that I can feel it. So when we put them all together, she can do them. She
So
passes them
the
all
anterior
together.
tibialis is okay,
Yep.
but then the individual.
Yeah.
And which ones are those? The extensor digitorum longus.
The
and
extensors,
hallucis longus?
the extensor and the hallucis and the extensor digitorum
Yeah, you can see
are too
that
tight. Yeah.
even if they can bend more, you can see that end feel is really resistant.
Right.
Yeah.
So again, for the anterior tibialis and for the hallucis and for the digitorum, we're going to come down and then we're going to pronate, which she can pass. She passes that one.
Okay, so anterior tibialis,
And then
okay.
here, let's go to the great toe. And not quite as tight.
That looks better than the other side,
Yeah,
right?
yeah. And then here. So yeah, so all, this one's the digitorum is pretty tight there. Yeah. Okay. So we got a few of those tests there. So the next one we're gonna do, we're gonna do 43 and 44, 43. So here we did that 43 and 44. We're gonna do the Proneus test here. So we're gonna just make sure that we can invert the foot here. So we want to invert it. We want the midline. You want the foot to go past the midline about 30 degrees. So it's doing that. Okay.
Yeah, that looks pretty good.
Let's try it on this side and see if it can go at least 30, and it can do that.
Yeah.
So it's passing and coming about 30 degrees. So you're doing pretty good there. All right. Okay. All right. So we're gonna take a look at treating, especially the adductor longus.
Do you want to do
on this side.
Do you want to do the strength test quick? As well?
Oh, the strength test. Let's do the strength test too. Let's do
Really?
it. Yeah, let's do
Okay.
it.
So for adductors, remember we talked about they adduct the legs. They add the two legs together.
Let's add them together.
Let's add them together. So I'm going to support here. Have you push in against my hand. She contracts first. You push in, then I add. 1, 2, 3. Okay. And she can resist against 3 increments of increased strength.
How'd that feel?
Felt fine.
Good.
Exactly. So you push in first. Make sure she gets to push first. Then I add 1,
Thanks for the
2,
hearts.
3, 4. Okay. Good.
Good.
No problem
Super.
with the adductor strength test.
Great. No trouble with that.
Okay. So then we have.
With the tibialis and the digitorum and the hallucis.
Okay. So the anterior tibialis comes here, wraps around here, right? So what does it do? It turns the foot up and in like that. When you stretch it, that's why we go like this. So the opposite would be to contract it like that. Okay, hold that in that position. And for this, you really need to get a lot of leverage. So I'm going to pronate her foot and extend it. Or flex it. Pronate and flex it while she resists. Keep your foot up like that. Pronate and 1, 2, 3. And that's plenty strong there.
What you call strong?
And here, up and in. Good. When it's weak, they won't be able to bring it up and in. They'll try and they'll be like, oh, well, hang on. You see, relax your foot again. Bring it up and in. You see how that, you can see the muscle contracts. Everything's working pretty good there. Okay. And I say push into my hand. And then 1, 2, 3. And there's no way that's moving at all.
So
Okay?
she has slight bunions. But she had no bunion. She has a slight bunion on this one. But this one went away from just wearing the shoe inserts and treating herself. She's been treating herself, and both of them are better, but this one isn't better enough.
Uh-huh.
Right?
Yes.
Exactly.
Right.
Well, so
this
that
one-
likely means there's a
so how
muscle
was
in
this
here
one?
somewhere.
How was this one before? This one.
That one, I wore the soulmates for 6 months, and it just kind of went away by itself. Like, it
Okay.
just shrank.
Just went away by itself.
Oh, yeah,
Mhm.
but then, like, treating a little bit around.
Treating a little bit. Okay, so that was but then this one here didn't have as good results.
No.
Yeah. So
It's
so she's
stagnant.
wondering why doesn't that one get as good as the other one? Okay. All right. Okay, and we're going to do one more. Oh,
Okay,
go ahead.
so for the toes, flex this back in that same position, and then I pull 1, 2, 3. See how it flicks? That's good. It's good,
Okay,
strong.
and the lesser
for
toes?
Lesser toes, same thing. Push up. Okay, and this up. Yep, and up. Yep, and up. Yep, those are
Okay,
all
how-
pretty good.
So and you do this one.
Yeah, do this one. So up, toe all the way back, resist. It's plenty good. Okay, toes back, back. Pretty good. It's yeah, that was really good. That second one may be a little bit weak. So
Okay.
try the second one again. Try the second one.
No, that was.
The second one has a little
that was
sponginess.
That one won't work.
That one didn't want to work so well.
Could you also do the flexor digitorum longus as well? The flexors,
Yeah.
would you?
Yeah, sure. So for flexors, curl the toes down. Okay, curl your toe down as much as you can. Oh, I can already tell that. Okay, resist as I uncurl. So I'll uncurl. I mean, you can't even get them curled down. See, they just.
Can I
That-
get?
Yes.
I can't see what you're doing.
Sorry.
Okay, I want to get this side. Okay.
So for curling toes down, curl the toes down, and I'm going to uncurl. Okay, resist. It doesn't seem to be much I can do with
No.
the great toe. It's giving way. Sorry. Okay, try the little toes. I'm trying to make it. I'm trying to make it obvious for demonstration purposes. See, curl these toes down. Yeah. See this. There's better in the toes, especially here. That great toe, though. Curl that great toe down. It just it doesn't want to stay there at all. Okay.
Okay. This
So,
one.
yep, same thing here. Curl those down. Okay. Okay.
Okay.
Uncurl
Try
the
to
big
uncurl them.
Oh yeah, this great toe curls just fine. It definitely holds. And these two, curl these toes down. Yeah. Yeah, I think from right over here.
Okay.
Try again. Sorry, you got a little foot cramp?
Yeah, it's cramped.
Okay, I won't do it. But she curls down like this, and then I pull, and she resists. She did really well. Okay, do you want
So-
to stretch your feet?
What?
That's it. That'll uncramp it. That'll uncramp it. Wow, sorry about that.
Okay.
So some issues
So the
maybe
weak,
there.
the
Go
weak
ahead.
one, Justin, was the anterior tibialis on the side.
No,
The helicis.
yeah, extensor
The
helicis.
extensor helicis. That was it. Okay. So the weak one was the extensor helicis on this side.
Yeah, was it on this?
And then also she was weak on her flexors.
Yeah,
Yeah.
the toe,
The toe, all the
this flexor was weak, and I think everything else was pretty okay, but this
Yeah.
toe was real weak.
We're going to do, have you lay on your tummy, and we're going to do the...
Oh, and peroneus tertius. Remember last one, peroneus tertius goes up and out, right?
Okay,
Peroneus tertius up and out. Peroneus longus and brevis go up, down and out.
right,
Peroneus tertius goes up
up and out.
Okay.
Yeah, so you're going to do that one.
And
Yeah.
then here, resist one. No, that's nothing going there. When these muscles, regardless of how strong they are, when they lock, when they overlap, they lock solid. And push, I mean, your whole body weight, nothing, won't even move. So that's good.
So those are good. Your
Yeah.
tertiuses are good. Okay.
Yeah.
Okay, if you can lay in your tummy, we're going to do the bent leg range of motion test for the
Great.
digitorum.
Okay, great.
Okay, so good. Just lay in your tummy and relax for just a minute. So we want to go at a right angle first, and then we want to go down at least 20 degrees, which she's doing.
Yeah.
Okay, and then we're going to go to we want the digitorum. So let's do it with the digits. We're doing that. Let's try the other one. So here's the digitorum. So the whole foot together. So get it at right angle, get it 90 degrees, and then this one's a little stiffer, isn't it? Yeah. So this one here is this one here, the digitorum, isn't as flexible. So it's not as flexible as the other one.
What number is this? Is that on the chart? Someone asked?
Yes. So this is this one right here. This is 39.
39.
So this is the bent leg dorsiflexion. And another test we could do would be for bent leg dorsiflexion would be the standing heel down test.
That's
heel
a lot.
down,
That's a lot for
heel
soleus
down
too, right?
Yeah. Oh, definitely for soleus. Yeah. Okay. So
So were you having
go ahead and
any
stand up for a minute.
pain
Yeah.
in that area?
I've been having pain with the left foot for the longest time.
So the left foot's been bothering you. Yeah.
Okay.
Okay. So let's do a deep knee bend and see if you can keep your heels down on the. Great. Okay, and then we're going to measure from the ischial tuberosity to the floor. Okay, so that's 8.5 inches. Super. Okay, so let's take a look at you on the table. Go ahead and lay on the table. So we're going to treat, let's treat the adductors that didn't pass. Okay, let's treat that one.
Okay.
Adductors didn't pass. What do you say?
Yes.
We'll do it?
Yeah.
Okay, let's give it a try. Okay, so remember they attach here onto the,
Limp.
the attachment is painful. Okay, so they attach here onto the pelvis and then here onto the leg, yeah. So So let's put a little heat on that. I've got a little heat prepared.
Okay.
Put a little heat right there. All right. We'll do the tibialis while we're waiting, okay? So we'll put a little heat on it, all right? Okay, so let's take a look at the tibialis. So here we're thinking about pain that comes right here. We're thinking what causes pain right here. And one of them is the tibialis anterior. So we're gonna feel the fibula, feel the tibia, and we're gonna come right here, right there. That's where the tibialis anterior is. So here we're right on the attachment.
Elbow's pretty good on this one too, right?
Yes. Let's go to the elbow.
Yeah.
Yes, let's do that.
You want me to raise it down?
You can make it go a little higher. So if I'm going to treat with my arms extended, I would have the table down lower, and if I'm going to treat with the table up higher, then I might use my elbow, just like that. So then I might use a lot of variation. Then I use different parts and I bend different ways. It's all good. keeps your bone density good.
Yeah.
Yeah. So I like to treat it a lot of times in range of motion. So I'd like to take a look at the range of motion while I'm treating. So here I'm using my thumb.
Yeah, that works too.
Yeah.
Let's put everybody on the spot. So what would trigger points in the anterior tibialis and or weakness of the anterior tibialis? What kind of pain might they complain? What common complaint?
They'd be complaining of pain along the tibia here, plus front of the ankle pain, and really bad great toe pain. I mean, really bad great toe pain.
Yeah.
Yeah.
And they might come in saying they've got shin splints.
Wow, you're right, shin
Shin
splints. So this is
common thing.
anterior compartment syndrome.
Yeah.
Yeah,
anterior
or shin
compartment
splints.
syndrome. Shin
Yeah.
splints, exactly.
Yeah, exactly. So here we're coming down, and here we're to the little tendon. And we're coming down, right along all the way to its attachment.
How many origin points are there for the anterior tibialis? All along the shin. Every single part along the shin, there's an attachment to the bone. So to just think about that, that's, oh gosh, thousands and thousands of attachment points in there.
So I like to shorten it really good and lengthen it and feel all those little places where it attaches, and look for any taut bands that don't want to contract and don't want to stretch. I can feel some right here. She agrees.
So on the macro range of motion, she wasn't too bad, am I right?
Yeah, she was
And on the bulk strength testing, she wasn't too bad.
correct.
But palpation is the golden rule, because palpation tells you the micro range of motion. And so there are some tender spots and areas where it's not contracting, it's not stretching and contracting fully.
Okay, so let's come back up here. We're going to take a look at the adductor again. Okay, so we put a little heat on it.
Great.
Right. Okay, so here is where it's attaching onto the pelvis. Okay, so find the pubis and come a little bit lateral, and that's there, and then we're attaching over here onto the femur. Okay, so we're going to go ahead and let's go ahead and press in here, and we're going to look for some. We're going to go a little bit like this and look for some taut bands. How painful? Any painful spots there?
Yeah.
Some painful spots. So it's painful enough.
Yeah.
And it didn't do as well in the range of motion test on that side.
No, this one was not happy in its range of motion test. So
Yeah.
that's particularly why we were treating this one. And we're coming over here to the femur. So I'm going to look for a few taut bands, nice and slow.
Sorry.
And I like to take it through range of motion and see what it does. So let's feel it. Adduct. And adduct. And stretch. And adduct. So it's pretty good. Pretty good. I'm looking for what's not good. Okay, right here.
Yeah.
So that part didn't stretch and contract. So that's the part I'm going to treat. So I'm looking for the parts that don't do their job.
Which again, it feels like.
So when you shorten it, you can feel that the fibers aren't shortening, and when you stretch it, you can feel that they're not stretching.
Cool.
So when you're coming in like this, you're like micro stretching, right where you put your elbow or your finger.
Right.
And so I'm coming in here and like micro stretching. Yeah, I can feel this is it right here, right there, right? Yeah.
Yeah.
She agrees.
Yeah. So we're right
We
on
have
some
consensus.
taut bands right there. And we could check it again. So here, just the attachment here on the pelvis was painful too. Yeah. So frequently we put heat on first at home. Maybe take a shower or put some heating pad on. And at the clinic, sometimes we use a heating pad or a hot water bottle or a hot water bag. Yeah. Okay.
Or a
So.
purse. Sack. Satchel.
Yeah.
Anything better than foam and tech.
Oh.
Where there's no foam, I don't get the Mentec part. I don't
There's no
understand.
form.
It's technical.
Technical? It's not technical.
Okay, well, you know why it's technical?
Yeah, I know
Because
why.
it was okay. Fine.
But you can tell me. It's
Okay.
fine. It'd be better if you tell me.
Okay, all right. So it was discovered. The plastic was discovered in the space race.
Yeah. It's the same kind of plastic they use in space or something.
So here we improved your range of motion here quite a bit. So now it's about where where the
much
other side
better,
is.
yeah.
Or if we came up this way.
Yeah. Oh yeah. Much better.
So that's good. So we did good. Yeah. Okay. So that's so one thing that might be causing your bunion trouble are some of these dysfunctions we're finding. Yeah. Okay. Push towards me and relax. And push. So I'm trying to get it to really shorten. And push. And relax. And push. Good. So making sure that it has really good range of motion.
I don't even remember my own strength testing. Was this something on this toe tested week? Stuff
The
you remember?
extensors. Okay,
The extensor of that toe? Oh,
So I
okay.
thought we would the extensors were not as strong.
Okay, good. Yeah.
Okay, so let's go ahead. We'll treat them.
Yeah. Let's treat those.
Okay, so we treated the things that cause the pain here,
Uh-huh.
and now we're going to go ahead and treat the things that cause the anterior ankle pain.
Yeah.
Okay. So that would be the tibialis anterior, the helicis, and the digitorum.
And you did the anterior already, right? Did the tibialis anterior.
Yes, we did.
So now you can do the
Yeah.
digitorum and
Yeah.
the
So here we're
helicis.
going to find the tibialis anterior, come just a
Okay.
little bit more lateral.
Okay.
Find the fibula, come a little bit more medial, and that's
Gotcha.
where the digitorum would be.
All right.
Okay.
So in between the peroneal and the.
Yeah.
And
So I'm going to go
something
right on that, and let's go ahead. We'll stretch it a little bit while we're treating it.
And if you're ever not exactly sure, just have the muscle contract and feel which part of it comes up.
So the four muscles that for this would be the tibialis anterior, the extensor digitorum longus, the extensor helicis, and the peroneus tertius.
Yes, exactly.
They were strong. The tertius
Yeah,
were
the
really
tertius
strong.
was fine.
Really
yeah,
strong.
yeah.
So they're not causing any of your troubles. Okay, so I'm just going to go through here and just go ahead and give it a nice stretch.
Yeah, they pass range of motion, they pass strength, and we'll see what they do with palpation, but likely they'll be good. Is this one? Is that are you noticing that one, Steph?
Yeah.
Okay.
That one's good.
So these pull the toes back in that way, so I guess that could contribute to if they're weak and not doing their job because of trigger points, then they could have some bunion formation by rolling in too much, maybe.
Yes. Well, if some muscles aren't working, then others have to do their jobs.
Yeah, yeah.
So yes, we could see if we could correct all the dysfunctions. It would help to not put so much pressure on your great toe. So right here we're coming down to each one of the lesser toes. Okay,
Ouch,
this is
right?
hurting. Okay.
Oh gosh, yeah.
This is hurting, so we'll go lightly.
Yeah.
And come all the way down to the toe. And we're going to go to the next toe.
I learned from Sharon that massage, now we don't really use that word a lot around here, but massage is not only done to muscles, it's done to skin, ligaments,
Yes.
periosteum around the bone, it's done to fascia, it's done to tendons. So
We like to use massage techniques
pretty much any soft
for
tissue.
pain relief. Okay, and we'll come to the next toe.
Even organs in some cases. Actually, I never even know. Do you do much organ treatment? Do you ever use much
I
visceral
like to
techniques?
treat all the fascia around the viscera.
That's what I thought. Yeah.
So if we could, where we can reach it.
Yeah.
Okay, and our lesser toes here. What do you think that this one's not as bad?
I'm watching her expressions.
She's got some good ones.
Oh yeah.
This way.
How does it get like this? Yeah, so I'll give you a pillow for your head, maybe. Want a pillow for your head?
I can give her a pillow.
Maybe
Good.
a bit to chomp onto.
Is that good?
Yeah.
Okay, and all the way down to the baby toe here. Great. Okay, so we're going to look at the halices. Okay, so let's take a picture of that. Let's see if we have a nice picture of that.
Of the extensor?
Yeah,
Or-
here's our extensor halicis. Okay, and it causes really bad great toe. Okay, and we're going to take a look at that one. So we're going to go ahead and take a look at it here. So go ahead and press your toe up and relax. Okay, it's right here. And relax.
I see.
Okay,
So
mhm.
there's an extensor digitorum, and then right here a branch comes off here. That's the.
Relax.
Well, that part has always been.
You don't have to move it.
I've had that be very sore before, but I didn't realize it was a separate muscle.
So here, and it could be, see this one here?
Yeah.
It could be pulling the great toe this way also, because you can see how it's coming this way. So this could also be causing trouble with the great toe, coming medial.
Yeah, that's interesting.
I meant this way, lateral.
Yeah,
Sorry.
yeah. Well, medial if you're in the center
Well,
of the foot.
Depending on where you are.
Yeah. So it kind of starts about where the tertius does on the back, on the side, right?
Mhm.
It's about half.
So here's our tibialis anterior here.
Right.
Then here's our fibula. So about halfway between the two, right there is where you could feel it by having her resist and push up, and you can feel it there.
Yep.
And then we got it right there.
Great. And of course, any problems with any of these muscles could be coming from nerve roots, the spinal column too.
So some of the ways I like to treat that is I come up and reach underneath and treat from underneath. So that's one good way.
Yeah.
So maybe we'll do that way. And again, we did it on the wall.
Yeah,
There was
yeah,
two
we
different
did that,
ways.
yeah.
Okay, so we took a look we didn't take a look at the abductor halicis for the. We didn't do the peroneus. Let's look at the peroneus tertius. Okay, so we're going to take a look at that. Oh, she going to help us find this? Great, we'll find it for us. Okay, so here is our peroneus tertius, and this also causes front of the ankle pain. So So we're going to take a look at the proteus right here. So here, take a look at our picture. Oh, you're plugging in? Okay. Yeah, it doesn't last. Okay, so here we're going to look at the proneus. So here's our proneals on the outside of the leg here. Okay, coming down this way, coming down like this. And then here's our tertius, and it's going to come and attach over to here.
Yep, going right in front of the ankle.
In front of the ankle. So I'm gonna, here's right from there to there. So we're stretching it a little bit while we're pressing on it.
And so there are spots there, so that's a positive. Even if the range of motion and strength tests were good, palpation is a golden rule. If you feel knots and taut bands, tender points, doesn't matter what other tests say, that's a positive.
And let's press onto it, and let's take it through full range. So up this way, and then that way, this way, that way, this way.
Got you in there.
Right, all the way to here. Super. Okay, so and remember the proneus longus comes to here, and then comes across and goes all the way over to here.
Yep.
And then remember we said the anterior tibialis comes here and goes all the way and attaches to there. Okay.
And there's only one more guy, the posterior tibialis also, by the way, just for information. Posterior tibialis comes in behind and grabs there too. There's actually 3 muscles that hold that.
The tibialis, yeah, tibialis,
So, yeah.
posterior, right.
Yeah.
Okay, so we took a look at quite a few of the muscles here. And I'd like to look at, usually when I'm going to get rid of a bunion, I usually also actually treat the bunion part here. And I encourage the toe to come this way. And go ahead and treat the interossei as well. And I also like to treat the helicis adductor. And the abductor.
We didn't do the adductor helicis yet.
Well, we could do it.
Okay.
Let's particularly do the abductor helicis as well. Okay, so let's take a look at the abductor helicis. Now this is for medial ankle pain.
Yeah.
Okay?
Yeah.
So we're going to take a look at the abductor helicis. So remember, it's attaching right here on the heel.
Right.
So let's take a look at right there on the heel.
And that's all belly and through there.
Right here. And then let's stretch it and contract it. Stretch it, contract it. Stretch it, contract. And we're going to come all the way to where it attaches.
And then it becomes more of a tendon right around there.
Right. Definitely. So here. Do you sometimes treat your anterior, your abductor helicis?
I will now.
Okay, here's your abductor, and we're going to abduct it really good and see if we can really feel it. Yeah. So really abduct it and really stretch it. And
Oh, by the way, strength test for those I forgot to do. You have them hold the toe to the side, and then you resist.
Great, let's do it.
Yeah. So have her start all the way out.
Okay,
So
start
let
to
her
push.
contract first.
Okay, contract first. Go ahead and push out, and then I'm going to push.
Yeah. So let her do as much as you can by herself. So push all the way out. Yeah. See how it doesn't even. Can you move it? Can you move it that way?
Doesn't want to
It
go that way.
doesn't even want to go that way.
No, she wants to use her hand.
How about this toe? How about this toe? Will this toe?
Okay.
Can you get this toe to come out?
Okay, so come out. She's doing it.
Push. Yeah. See, it does provide some resistance. And this one, push the toe out. Push toe out. No, it just
No
folds.
resistance.
It's just like.
Yeah. So this would.
Yeah.
So our abductor here would help.
Sure.
So if we can go in there, really treat our abductor. Remember, it's the whole heel. You're going to come in and come like that.
Wow.
Really treat that part. Really treat it.
That's remarkable.
Get right in there.
So that's why that bunion obviously is not going away on that side. You could just see how that abductor muscle is just flopping. Like
I would do one more. I would do the flexor here and really train the flexor to really do its job. Yeah. So really flex it. and make sure that we also, the adductor isn't adducting too much, okay? So for that, remember we're going to put our finger, we'll stretch the toes, and then we're going to treat the adductor helicis. Right there. And make sure it's not adducting too much. And of course you could do that on the floor with a ball. Then I like to get right onto it. I like to abduct it, then adduct it, then abduct it. I do it the toes. I really feel how they're doing their job. And then also down here to the tarsals.
Oh, Jim.
Yeah.
You're supposed to
Oh.
Sorry. Grab a towel from inside that cabinet. Thanks. My bad. Sorry about that.
Okay. Okay, so where were we? Okay.
We were
All right,
trying to
so-
figure out why this abductor does not want to
Yeah, so we're gonna
fire. What doesn't want to do anything?
Okay, so let's see. We might consider the nerve root for that one.
Yeah,
So
yeah.
what if we did the abductor helicis and the adductor helicis? Let's do S1 and S2. Let's take a look at that.
There's
So I'll do it right while she's laying down. Okay.
great. Yeah.
So let's go ahead and remember to find L4. We're going to just find the upper part of the ilium, the top part of the hip. Let's go to L4. Let's go down. Let's check L4. Let's check L3. And let's do S1. So here I have my fingers like curled up like this and pressing in. And I'm looking for taut bands in the rotatories, multifidus, and then some of the fascia. Right there. Okay, so I'm right on S1 and S2.
Because you want her to walk away with, passing the range of motion test if possible, and passing the strength test for sure. Yes, movement of the hip is very helpful because it's
Well, I'm
stretching.
stretching. Right here I'm rotating the rotators and the multifidus, and I'm contracting them and rotating them.
And you're
And
stretching,
stretching
the
and
little
contracting them,
yeah, the little
stretching them,
yeah,
contracting them.
and the flexors and extensors, all those little intersegmental extensor muscles and stuff. All that,
Okay, so let's see if we improved it a little bit. Okay, so go ahead and you can do that test if you want.
Okay. Just bring this toe out, and I'm going to push in. Yeah, it's definitely a lot better. Yeah, good. Tons
Oh,
better. Oh, she can move it that way.
see?
Push.
Okay.
Down here.
It's cramping. Oh.
Oh,
See it?
oh, that muscle's working. Okay.
Oh my gosh, it's
Woo.
cramping. Wow.
Okay, let's stretch it. Okay, give it a good stretch. I'll put a little heat on it. Okay, here we go. Give it a good stretch. So we contracted and it stayed contracted, huh?
Did it awaken?
It woke up.
Yeah, it sure did.
Yeah, great. Well, so we woke it up, Stephanie. Okay, good. So we know that it's better if it increases the range of motion improves, and also if the strength improves, and if we get rid of the pain. So
Yeah.
and dysfunction, that we see.
So you want to try it one more? Can you flex it out? Yeah, and I'm gonna push. Wow, it just flopped over a second ago, and now it's solid.
Yeah,
That's great.
so it's really so.
So
that
did
was
you
from-
see how the lumbar
So
involvement?
So we treated the muscles themselves, but it was still
nerves.
weak.
Yeah.
So then we
Sacral.
treated the lumbar and sacral multifidi rotatories, and all of a sudden it got strong.
Bingo bango.
So then one thing we might recommend is that she also treats those herself.
Absolutely.
Yeah, she could treat those herself, and we could have her treat the abductor. So abductor, and we could treat the L4, L5, S1, S2, and that like that. All right.
And if you wanted one little secret from neurology is that you also look at synergists and things like that. So actually, in this case, the abductor hallucis is synergistic with the posterior tibialis. And so the posterior tibialis bends the foot down and in like that.
Right.
And so hold that down and in like that.
Mm-hmm.
And then I'm going to resist. Are you?
Oh, you mean
Yeah.
she does.
Sorry, Steph. You hold that down and in. Yeah.
You're
You
gonna
see
resist?
how that folds away.
Okay.
So that might mean that
The
you wanna work
tibialis
posterior
posterior.
tibialis. Yeah.
Okay, so
Because they're synergistic in that motion.
yeah, so the tibialis posterior would be on the back of the tibia right there.
Ooh.
And we want to, for this, you want to find the tibia, then you go in and then towards the bone.
Ooh.
So we're going to go in and towards the bone, in and towards, and a lot of times I like to shorten it and then lengthen it,
Yeah.
and then shorten it and then lengthen it. It's a little less painful when you move it while you're doing it.
Yeah, she's breathing.
Yeah.
Oh,
So you're
that's
coming
nice.
this here.
Yeah. So yeah, no muscle is an island. They always work in, they have antagonists. The antagonist would be obviously the adductor hallucis, and also some of the, like the peronei, especially longus and brevis. But you also have a synergist. So I think we had that happen last week too, didn't we? We had one.
Well,
muscle.
we had something interesting. We treated we treated everything, but then we still had one muscle to treat, was the tibialis. I mean the peroneus longus and brevis.
Yeah, yeah.
And when we treated them, when they stopped being really tight and referring up into the spinal root, then everything else became strong.
Yeah.
Because everything tested weak. We had full range.
Yeah.
Everything's tested weak.
Right.
But the peroneals were really, really tight, so they were causing noxious information to go into the spinal cord.
Exactly.
And at L5 around, and then L4, L5, and we treated that muscle, released it at least 20%.
Yes.
And then it stops sending noxious information.
That's exactly the right word. It's the nociceptive information or noxious information causes the nervous system to want to shut that whole area down.
Yeah. In this
So,
case, the tight muscle, when we treated it, then everything else became strong. It was so interesting. It was really,
exactly.
everyone could go back last week and take a look at it.
Oh, and so I forgot to say, why did I think synergist? Anybody know? Because the muscle cramped when it contracted. That means it's used to doing more than its share. So a muscle that cramps, like if I were to, let's say I just flex my biceps and it were to cramp, I would think that maybe I have a weak synergist, like maybe my brachialis isn't firing. And so that's why it would cramp. So the tibialis posterior being synergistic in this, turning in of the foot like that, if that wasn't working, then this overworks and spasms when she gets it to contract. So it's like it was weak. We got it not to be weak anymore, but every time it contracted, it spasmed. So then you could look at its synergist. That's how
Great, super.
Yeah.
Well, it's always good to look at the synergists.
Yeah.
So that would be ideal.
Well, Sharon and I are both big proponents of, you don't, there's the pain, well then let's just treat here. We look at the whole system. There's nothing is functioning in space.
And Trevell and Simon would call it the myotatic unit.
Oh yeah, that's right. It's a whole unit. Yeah.
Okay, so we're going to take a look at your flexor.
Oh well, now that we
Digitorum.
treated that.
Oh, we're going to test the strength. Let's do it. Let's go ahead and test the strength. Okay.
Getting extra. This is bonus material. So this isn't one of the muscles that refers pain, but it's a synergist to one of the muscles that refers pain. So toes
Tibialis
down and in.
Posterior.
Right? You hold that in as I push up, in and out. And that's a lot better. I could say that there is more work to be done, probably. And you probably felt that too, right? Yeah. Okay? But now let's just see if this will cramp. When you push the toe out, good, and push. Oh, it's strong. 1, 2, 3. Any cramping? See?
Okay, we did it.
That's it.
So
Good.
we figured it out.
We figured it out.
Okay, so let's go ahead and let's have you turn over and lay on your tummy. Okay.
The dynamic trigger point duo. Yeah.
Okay, let's come up on your hands and knees for just a second.
That makes sense to everybody, right?
Oh no, I'll just leave this here. Just go put your feet off the end of the table.
What are we doing here?
We're going to do the flexor
Oh.
digitorum longus.
Oh, yeah, I forgot we didn't do that.
Okay, so for this we usually have the foot off the table.
Okay.
And we're going to take a look at it here. So so we could come about to right here. I could show us the picture.
Yeah, let's do it.
Okay, I'll do it. Okay. Right here. So here's our flexor digitorum longus. Attaches onto the posterior tibia. Come down, and then to all the toes.
Yes.
Okay. And
once again, hallucis gets its own guy, doesn't it?
Oh, it does. Hallucis has its own muscle, and it comes down this way to the great toe.
That is because that literally is the push-off point for your entire body when you're walking. So you need lots of extra stabilization. The first ray. Did you guys call it the first ray in school?
No, we didn't. No.
It's called the first ray when I was taught.
In chiropractic?
Yeah, the big toe.
Okay.
Has its own entity.
Its own ray.
Yeah.
Okay, so we're gonna we can feel the flexor digitorum. If we want, go ahead and push your toes against me here, right there, and relax. And so I like to treat it like this on the short all the way, and then on the long, and then on the short all the way, and on the long, and on the short.
It's neat for you guys to see that the progression of things. First metatarsal lift fixed the bunion on one side, but it didn't on the other. And we went in and we looked, and what would you know? The abductor hallucis is not working on the side that the bunion didn't fix. So
And
then we got it working, and so now, and then we had to look at its synergist, and we had to look at its nerve root. So it could have been something that started in the lumbar spine, that then irritated that nerve that then caused the abductor hallucis.
But remember what Dr. Fisher used to always say. He used to say, always, whenever you have a dysfunctional muscle, it always is sending noxious information into the spinal cord.
It sure is.
So it wouldn't be uncommon.
No, it's not uncommon at all.
So I remember Dr. Fisher and Dr. Simons arguing about that one time.
Oh, really?
Dr. Fisher was saying that Dr. Simons should put more emphasis on that in the book, and Dr. Dr. Simons was mildly disagreeing with the importance that he was placing on it.
Yeah. Well, you see, in some cases it's the key, in some cases it's not.
That's right. That's right. So. We'll see. They were talking about the volume 3, and actually volume 3 is coming out.
Oh no!
Yes, it is. It is. Yes, it is. Yeah. Everyone's been working on it feverishly.
But what's it going to cover?
It's going to be the new version of volume 1 and volume 2 mixed together.
Gotcha.
Yeah, and Dr. Simons was working on this before. In fact, he wrote me something about it the day before he died.
Oh, jeez.
Yeah, he was working on it like he wasn't going to die. He was keeping working. Oh. Okay, so I'm just going to take again a good look at all the digits, and I'm going to feel it really on the short and on the long, and really on the short and on the long. Great. Okay. All right. So we treated all the muscles.
That's it?
Yeah.
We did the adductor.
Well, we could do that too. Let's do that.
I don't think we did that as a.
Well, let's do it. Let's do it then.
Yeah.
We
did self-care, but I don't think we did.
All right, let's do it. Okay, so we're going to do the flexor hallucis, and for this, I like to feel it a little bit on the stretch. So remember, this is bringing the hallucis this way.
You're very welcome. By the way, next week, guys, finally, Periscope has contacted us, and they're going to try and fix the problem that happened. So we should be able to have our your NSCA account back by next week. But even if so, what we'll do is we'll have both phones and accounts running so that whoever is there will be able to help them get to the other. Are we
gonna broadcast on 2 phones?
Well, in the beginning, until we get everybody transferred.
Okay,
over.
good. Yeah. Great. So, okay, now I like to feel the fibers that are pulling the great toe to the medial. So I'm going to take it lateral and I feel the fibers pulling and stretching. So I get right on it. And right here.
When you know the range of motion test and you know the strength test, then you really, without thinking about it, you've really understood the function of that muscle. You know how you know what its range of motion is, and you know which direction it's contracting, and you just start playing with that, and all sorts of intelligence inside of you that you couldn't even describe in words is going to start blossoming, and you'll start knowing stuff without even knowing why you're knowing it, just because you're getting
you
in
figured
tune
it
with
out.
Yeah. You're getting onto that wavelength and understanding its function, you know.
It seems a lot better. Is it changing a little bit as I'm doing it? You can feel it, right?
Yes.
Yeah, it's starting to feel like, this is what I always say, it's starting to feel like a well-oiled
Yes.
machine here.
Yeah.
Like this really well-oiled.
Exactly.
And I like to do this to all my toes and all the muscles in my feet and get them all to really work really well. I just love it.
She does. She's a nut.
Okay, I just have to have feet, you know, I just have to have feet. Okay, now you can see that she's doing a better job
Yes.
than we did at the beginning. So she's got a really good range of motion now. Okay, good.
And maybe this wasn't primary. Maybe all that other dysfunction was primary, but, you know, you treat the secondary and tertiary things too.
Okay, great. Do you want to test any strength tests? But
We could do it in this way. So flex the toe down. Yep, like that. Good. And I'm going to pull. Okay, that's plenty strong. I don't remember if they were before. And this one, yeah, this one was pretty good before. Cramping it.
And the calves.
you stretch it. Go ahead and stretch it. Stretch it.
I know it. There you go. Yeah.
Okay, what do we do for calf cramps?
Yeah, what do we do for
Okay,
calf cramps?
okay,
'Cause
so
I would think a
let's go ahead.
synergist is really
So
big.
go put it really on the
problem.
stretch,
Okay.
Justin. Okay.
Yes.
Okay, so we're
Okay.
going to put it really on the stretch.
Yep.
And we're going to treat it while it's stretched. So this would be our gastrocnemius.
Yeah.
Remember, the gastrocnemius causes plantar fasciitis. It's the main one that causes plantar fasciitis. Okay, the pain at the midfoot.
Yeah.
Okay, so if you have pain at the midfoot, well, you know, a lot of these different things could cause plantar fasciitis.
Yeah,
you know?
sure.
But like the tarsal tunnel, so the little
Yeah.
ligaments that make up the tarsal tunnel, holding the tendons down.
Yep.
It could be, and that could also cause you to have the feeling of plantar fasciitis.
Yeah. And the three muscles that help with the sling, the posterior tibialis, the anterior tibialis, and the peronei, those, of course.
So the part that causes the pain to the midfoot, the plantar fasciitis, would be right way up here.
Yeah, right.
It'd be right there, so we get it on the stretch right there, and we treat it like that.
So yeah, so a cramping like that, I would think either weak synergist or weak antagonist, because one muscle's like a seesaw. It's like one kid is too big on the seesaw, and it's, you know, cramping on the side that the big kid's on. So someone on the other side needs to pull their weight. So we need to, you know, get another kid on the other side of the seesaw, and then, you know, they can go up and down without one person cramping. And,
Okay, so can we test the strength?
Yeah. Strength. Well, they were strong before. They just cramped.
You were just testing something.
Yeah, I was just testing.
Yeah.
They were strong before, but they cramped.
Okay, they were cramped. Okay, I just wanted to
Still
see
cramping?
if they cramped.
No.
No,
That's
they didn't
what-
cramp.
That's what I was trying to do.
Yeah,
I wanted to
good.
see if they cramped this
Yeah,
time.
try again.
Okay.
I'm curling, strong.
Okay,
and
so-
no cramping.
So
Right?
you
Excellent.
might say that in almost in all cases, when you're treating this part of the body, you probably wouldn't just treat the muscles. That you treat probably.
You would treat. Yes.
You'd always treat gastrocnemius first.
Yeah,
Okay. And so, you know.
Yeah, I mean, we are taking the pain keys out one by one.
Yeah.
And you know, but
So here, but what I love. So everyone who's got a restless leg syndrome, you could be treating all these muscles in the thigh, all those muscles we treated already in the hip,
Sure.
and also the lower leg, and get rid of restless leg syndrome, and we won't have to take all the whatever medication is recommended.
Yeah.
So we calm down the nervous system this way instead of that way.
Yep.
So this was the way we did it, like that.
So,
Okay,
so this
okay.
side had the weak posterior tibialis, so maybe the gastrocs had learned to overcompensate as well, you know? So then that's another reason why they've been cramping. So now she worked on that, so it's not spasming. So
Well,
I would
didn't
say...
cramp, so we treated it and then stopped cramping, so
Exactly.
it could just be the gastrocnemius had trigger points. Yeah.
Right.
Yeah.
Well, yeah, never however got them. But
Yeah.
so I would say this side should be functioning quite a bit better now.
Well, we got a few ideas for you.
I mean, we
Once you
did.
come up onto your and stand up, sit up, and then stand up.
Yeah. It's always fun to find some real key, like, causation
And stay there for a second.
findings.
Breathe and
Like,
relax.
that's always nice.
So, so next week, what are we doing?
Next week.
Yes.
We're coming back again next week? How long does this program
Okay,
go?
so next week, so just relax for a second. I'll figure it out.
Of course.
Okay, so we're going to do the back of the leg and the back of the ankle. So we're going to do posterior leg and posterior ankle.
Does that include the
Okay.
calcaneus? All
Yeah,
that
we're
stuff?
going to do calcaneus. We're going to do Achilles tendonitis.
Well, I used to have hairline fractures in my heel or something, they told me, when I was younger.
Oh, really?
Yeah, is that,
Okay.
I bet you could have fixed that.
We probably could have. We could put, yeah. So we're going to do the posterior leg, 31.
Yep.
Posterior leg, and we're going to be doing posterior ankle. So that'd be 34. So if
You know, it's
everyone could
cool.
download 31.
They know all those muscles already. We've covered all these muscles. It's great. You know all these.
Yeah, so we got so we'll just again we'll do the gastrocnemius again, semitendinosus, the membranosus, the flexor digitorum, tibialis. We did that today.
Yeah, exactly.
And then we didn't do plantaris,
That's
but
right.
we'll do that.
That's right. You guys really haven't seen tibialis posterior or plantaris that much yet.
Yeah, so
That's
we'll do
great.
that. And then for posterior heel, we'll be again doing the soleus and tibialis posterior.
There you go.
Yeah.
Perfect.
So those are next week. And
Perfect.
so we'll be calf cramps and heel pain,
Well, I mean,
runner's heel.
so at this point through the program, you can fix anything on the back of the torso and on the the front and the back, and you'll be able to cover everything in the legs and feet. And then all we'll have is the upper extremities.
Well, pretty soon we're going to go to the heel pain.
Yeah.
And then we're going to be coming mid foot pain, and then we're going to do 41 metatarsal head pain,
Those are gonna
and then we're
feel
going to do
good.
42 and 43, which is the bottom of the great toe and the bottom of the lesser toes, and then we're going to do the top of the lesser toes and the top of the great toe, and 37 the top of the foot.
Those are going to be real fun.
So then we're going to start on the shoulder.
Yeah. And some of those will be grouped together. Each one is in the
Yeah,
class. There's
right.
plenty of groups.
So
together.
next class we're going to be doing 31 and 34. So
Boom.
31 and 34. So you could print those out.
Alrighty.
So we've got our ending music.
Closing song.
Our closing. We got our music here.
Sharon, I'm just in pain free.
You're welcome, guys.
Who want you to?
Okay, here we go. So here we go. Let's put our foot upside down.
We will
This way.
assess and
And this way. This way.
then compress and repeat.
Other foot.
When our
Stretch.
trigger
Contract.
point is
Stretch.
there,
Good.
we'll teach you how
Okay, let's do the Cronius.
to self-care.
Cronius.
Thank you for all your appreciation, guys.
We'll keep you at your peak.
Other foot.
So see you back again next week.
Woohoo! Bravo!